Hi, I'm Colleen Cullinan, a pediatric psychologist from Nemours Alfred I. DuPont Hospital for Children, and the title of my talk today is Anxiety, Resiliency, and Hakuna Matata, a somewhat problematic phrase. So today what I'm going to be covering is what is anxiety, and I'm going to cover it in the way that I talk to families about what anxiety is. I'm going to talk a little bit about who's anxious, who's at risk for having an anxiety disorder. I'm going to talk about brain development and anxiety, how to assess or ask questions about internalizing symptoms, and treating anxiety. So when I talk to families about what anxiety is, I talk about the B's. I talk about the brain, the things that we think about, the anxious thoughts that we might have. I talk about the body, the physiological responses that are activated with anxiety. Anxiety is really just a normal physiological response, cognitive response designed to protect us from harm and from danger. And our brains activate, our bodies activate, and we do certain things. Our behaviors are activated as well. And so this is how I talk about it with families. The relationship between these B's, between the brain, the body, behavior, is really complex. Nothing exists in a vacuum. These are interacting all the time. So sometimes what I'll do is I'll actually sit down with families and draw some of this out. I'll sit down and I'll put out a triangle that looks like this, that shows the relationship between the brain, what we think about, our body, what's activated in terms of racing heart or shortness of breath or feeling hot or trembly or tingly or any of those physical fight or flight reactions. And I talk about behavior, which usually looks like avoidance or escaping the situation. And I talk about how these things work together in concert to account for this emotion of anxiety. So when I sit down and draw this out with families, I try to solicit examples from the family about what they think about when they're anxious, what they feel in their bodies, and what they do with those feelings. When B's are activated, what's really happening is the brain, the body, and the entire system is perceiving threat, perceiving danger. And of course, when we're in danger, there's a logical response. So when the B's are activated and there's a perceived threat, it's that sensation that I'm in danger, and if we feel like we're in danger, we have to get out of the situation. And this works in the short term. When we feel this sense of danger, when our B's are activated, when we start to have those worried thoughts, that sensation of anxiety, it feels good in the short term to get out of the situation. And what we start to learn is, okay, good, that was the right move to get out, to avoid, to escape. Safety is the most important thing, and I'm safe because I got out of a situation that I felt was a danger. This works in the short term, but in the long term, it's what serves to maintain and perpetuate anxiety. When we learn that avoidance is the only way to stay safe, we make our worlds very, very small. And this is what's really at the heart of anxiety. So I'll draw this out for families too. A perceived threat, something that we think of as dangerous, can be anything. Our brains are pretty amazing when it comes to perceiving threat. For kids, social situations can be perceived as threats. Separating from a parent or a caregiver can be a threat. Test anxiety is really common for young kids. Anything that challenges competence or confidence. Questions of safety, am I okay? Are you okay? Is grandma okay? Are my friends okay? Those are really common anxiety questions. Even memories, our own thoughts can be perceived as threatening, can activate that B system. Novel situations and specific things like germs or spiders or vaccines. Who has anxiety? We all do. Anybody with a nervous system can have anxiety. The question is it actually distressing and is it actually impairing? Because we all have anxiety to some degree. Anybody with a brain, a body, and behavior is going to have some anxiety. Younger kids are more at risk than older kids. Girls are more at risk than boys to have full anxiety disorders. And temperament also appears to be something at play with anxiety. About 20 to 25% of kids have something called an inhibited temperament, which means they tend to be more reserved, tend to see danger in more places. So when you're asking questions and you're assessing anxiety, you want to ask questions. Are these behaviors and this response to danger, is it developmentally and culturally appropriate or not? Is it more disordered? Does it cause significant distress? Does it cause impairment or interference in daily life? Some questions about how long this has been going on and in what circumstances, and are there other potential explanations at play, like a medical issue, especially when you're talking about things like panic symptoms or other kinds of somatic symptoms. So again, when I'm trying to outline this for families, I'm trying to get at what's at the heart of anxiety. And for most people who are struggling with anxiety, for most kids that are struggling with anxiety, what's at the heart of it is escape and avoidance. I perceive a threat, and that threat typically is non-dangerous when we're talking about anxiety. But I feel like it is. My body reacts like I'm in true danger. It's almost like a false alarm system. And when I get out of that situation, when I avoid it, when I escape from that situation, it only reinforces the belief that I was in some sort of true danger. And it prevents the ability to learn that these stimuli, these threats, are not actually harmful in the long term. So I called this talk, I used Hakuna Matata and said it was a somewhat problematic phrase because no worries is actually the problem. Trying to avoid and escape and not have any discomfort works really nicely in the short term, but in the long term, it's actually problematic. So I try to teach this to parents, I try to teach this to kids, and then start to do some introducing about what is the treatment for anxiety. And by far and away, the most well-supported, evidence-based treatment is cognitive behavioral therapy. And I like to outline for families what the core components of CBT might be. It's typically education, which is kind of like what we've been talking about, how the bees respond to one another and interact to cause anxiety. And then the other core components of CBT treatment map on really nicely to those bees. So there's some strategies that are designed to manage those body sensations, things like relaxation training and breathing training. There are some strategies and interventions that are designed to take care of some of those brain things, the thoughts that we have, and challenging anxiety-provoking thoughts. But really what's at the core of CBT for anxiety is something called exposure, which means we're gonna do the thing that makes you feel uncomfortable, we're gonna think the thoughts or remember the memories or get in the situation that makes you uncomfortable so that you can habituate and learn that actually there's nothing dangerous about these situations. And so exposure therapy really is the key core component to CBT treatment. If this is what anxiety looks like, if our bees are activated, we feel like we're in danger, and this is the typical cycle of anxiety, exposure therapy is trying to block that avoidance, block that escape. And so a therapist working with CBT is going to help a child or a family to learn how to stay in situations that are fearful, to stay in situations that are uncomfortable, so that we can learn, okay, this actually isn't dangerous, and I can handle it, and I can handle threats, I can do tough things. And the more we have that experience, the more we learn that we can handle some of these feared stimuli, the easier it becomes to do that, and the more functional we can be in our day-to-day life. So the takeaways, the things that I think that you can do as medical professionals, as pediatricians, is to talk to families, to educate about what is anxiety, what are the bees, to talk about avoidance, how it works and why it's at the heart of anxiety, and then to start to introduce to families the most empirically supported treatment for anxiety, which is CBT, which involves education, relaxation training, thinking skills, and most importantly, exposure, which encourages kids to do the thing they're afraid of. The more they do it, the easier it gets. And with the support of a therapist, kids can really learn how to overcome or at least manage components of their anxiety. That's my talk. Thank you so much for joining me. It's been great.